Okay, guys, if you can hear me right now. So we're starting shortly. We're just waiting for everyone, and then we'll start straight away. Thank you, guys. Please, guys, if I'm on Facebook Live right now, please, guys, let me know. Let me admit everyone in here. We are live on YouTube as well, I believe. Guys, if I'm audible, please let me know. If I'm audible, please let me know. Please, guys, if I'm audible, let me know. I really appreciate it. Okay. Share. So let's share Google. Okay, guys, give 1 second, please, to make our champion to be co-host for everyone. Please, all the co-hosts, ensure you have stable connection. Okay. Okay, guys, please, guys, we are streaming this mock discussion through Zoom and also through Facebook and also through YouTube. So I'm not quite sure which one you favor the most. For me, I love Facebook. So if you like Facebook, so we can chat there and we can have our question answer there. And then otherwise, you can be here just only listen without asking any questions on Zoom or maybe YouTube. I believe this class will not be recorded. So most probably will be deleted after we finish. Okay. Let's go on the questions. Please, guys, if you are in, let me check what's happening on Facebook there. Guys, am I audible, guys? Please, guys, if I'm audible, let me know on the Zoom, on the Facebook. I'm not quite sure here. Please put your hand down if you have an access already. Otherwise, we'll get confused. Thank you. Let me check what's happening there. I'm not quite sure if we're live there. Yeah, it seems like we're live here, which is good. Please put your hand. Oh, I don't want to hear anything from this side. Yep. Which is very good. I can see things happening here. Okay, guys, before I start, I would love, am I audible? We hear you clearly. Okay, that's very good. Thanks, Dr. Adrove. Letting me know. I cannot get, I think this one could be bigger, smaller, I don't know how. It's good. Yeah, that is good. Sign. Okay. Okay, guys, I can see at least few comments from you in here, which is great then. I'm not quite sure why it's not very clear from my side. It should be clearer than this, but that's okay for now. Okay, guys, before I start, I would love to check with every one of you. How are you doing, guys? How's everything going with you? How is your preparation? Yes. Exam is very soon. And I know it's a little bit stressful at this stage. But we're doing our best. And I'm sure we'll be perfect for every one of you. Okay, guys. Let me say hi first to everyone. Guys, I'm happy to everyone. Yes. Okay. Seems like yes, I can see myself here. Okay, guys, should I start right now? I know. Okay, guys, anyway. This mock. Yes, everyone happy? I like you guys when you smile. Okay. This mock, it's actually very good mock because I believe it has lots of new information and new concepts for every one of you. Before I start, I would like to know your opinion about this mock. I know you found it hard. I have noticed this. And I explained to you in my sessions why it's a little bit tricky. And then once we go through the question answers, you will understand why. But what was your feelings while you answering this mock? And what was your feelings after you get the results? After you complete the mock? Anyway, I hope you enjoyed it, and then I believe you're gonna enjoy it more once we start discuss the mock. We're not going to read every single word because actually I believe you did the mock, so you understand what is in it. So we're going to jump straight away into the questions, and then if there's any relative information you need to go back again to the scenario, I will let you know. Guys, what do you think the answer for the first question? Is it A, B, C, D, or E? Which one? Let me check here your Facebook. Because I'm waiting for your answer on Facebook. A, alpha, up registration. Okay, we do something here first. I should see. Okay, start to work, which is good. Okay. Your answer is A, alpha, which is upper registration, which is true. We really need upper registration. Guys, which color like more? Black, red, which one's clear to you? Red, blue, or green? Which one do you like more? I think green not visible. Black not that much. That's what I can see from my side. I'm not quite sure there. And then it's mostly red or blue. Let's go with red now. That's it. Spray stuff. Stop now. I think should be fine. The red, okay, we go with red. Dr. Walija says she cannot see any color. I'm worried right now, Dr. Walija. Guys, no colors, guys? Okay, you can see my window? That's fine. Let me do something different now. Okay, guys, what about now? Can I see colors right now? I hope so. Yes, guys, can I see colors? That's okay, you will see. Wait, you will see, you will see. On Zoom, I can see. Yes, guys, everyone can see. That's good then. Okay, guys, let's start again. So I think red will be fine. So option A, which is up registration, definitely we need it. Correct. Provide a number. Yes, to claim for your services if you do any treatment, because now we're talking about CDBS, which is related to Medicare. So you claim your work, the treatment you've done, you need to provide a number to get your money from here. Therapeutic goods number, this is not for a dentist. This is something related to TGA. And it's mostly for companies. If you sell dental material or any materials you go in or medicine, and then you need to ensure it's TGA approved or not, because anything you're going to apply on a human, it should has TGA approval. So this is mostly for medicine and materials for companies, but not for dentists. So that was a distractor. So if you choose an A alpha, you choose the wrong option because this is distractor. The two things we need: app registration to work as a dentist, and then provide a number, which is to claim for the service you do. For example, check if you do comprehensive examination, and then you need to get the money back for this, and then you need to claim it, scale and clean, you need to claim it, restoration. So you need the provider number. And by the way, every clinic, like if you're going to work in different clinics, you must have a new provider number for every clinic. Guys, so the answer now is give me guys 1 second. Okay, guys, so the answer now is C, Charlie, right? Please, guys, if I select any wrong option accidentally, please let me know. I choose in C, okay? Next question. You are recently, yes, the same things, under the New South Wales Health Primary School Mobile Data Program. Which of the following groups are eligible to receive care at no cost? Guys, what do you think the right answer here? Is it A, which is students age under 17, or B, under 16, or under 18, or children aged between 2 years to 17 years, or just only rural or remote areas kids? If your answer is A, alpha, so I wouldn't say it's right, because it should be under 18, not under 17. When we say 2 to 17 means 17 plus. That could be 17 and 9 months, 17 years and 11 months. So it means under 18. And then it does mention who are eligible for CDBS. Actually, under the scheme, everyone mostly eligible as long as they have Medicare. So now, this is not right, because it should be under 18, not 17. That's not right, because it should be under 18, not 17. Because if you say under 17 means 2 to 16, which is wrong. It should be 2 to 17. That's correct. And then they should be eligible for Medicare. And this is information true as well. This correct. 2 to 17 correct. Who are eligible for CBDs, sorry, CDBS, and then unused fund available. This is not true. You don't need this. So regardless, as long as they have Medicaid, regardless this point, which is if there is any available funds or not, or are eligible to CDBS, they still can get it. D is wrong. E is wrong. Because this is totally, it's not about her, it's for everyone. Okay, lots of things to find. Don't go anywhere, please. So the answer now is C, child. Third question. Tom is a 6-year-old. Which of the following is most appropriate requirement to ensure treatment can one day, guys? I see which admin who's doing this, right? One day. I will know. Okay. What do you think is the right answer here? Is it A or B or C or D? A, it's by himself. B, one of the parents, teacher. Well, that's a great one. School principal. In this case, we need lots of principals in the school, right? Legally recognized witness. Okay. Mostly, the dentist here, they actually working for this scheme, especially in schools in rural areas. They understand exactly the routine of this. The daily routine, or most of the time, or the main objective, this scheme, one of the objectives, not the main, one of the objectives, right? That this scheme has been made actually because parents not available. They are busy. So routinely, what happens is the kids come to us without any one of this. By the kids by themselves only. But let's say if the parents want to attend, we have the pack consent. In this consent, there is one item. If the parents like to attend the treatment with the child, they should take it. And then we organize with the parents. So routinely, the parents not existed. The kids, they come after the parents, they sign the consent. So we send the consent to the parents or the legal guardian. Their guardian signed the consent for us. And then the kids come inside, let's say the van or the truck, wherever being used for this. So the answer is A. I know it's a little bit tricky, right? Guys, please, read about it, you'll understand better. you'll find lots of information in New South Wales Health website. So the answer is A alpha. Next question. Things getting more interesting, right? Guys, what do you think the answer to this question? What do you think the answer here? Let me check if you leave any question for me. By the way, guys, this information, I not how to every one of you to get it if you are living overseas, but that's okay. That's why I'm here. I'm trying to help you with this information because it's important type of information. You need to know it before you start work in Australia or before you go to exam. So you must understand about the Australian dentistry. I see now the answers between A, B, C. I'm happy there is no D and E so far. Okay. You decide a radiograph assessment is clinically indicated. The child is cooperative and the school confirms a signed consent pack. So the pack has been signed. Do you remember before I told you this pack, it has lots of items and every item has like a little square to tick. One of these lots of squares to tick is X-ray for assessment or checkup. So it means they really did it. Was retained, the pen currently unavailable. What is the most appropriate course of action? So now everything has been signed with no issues. The answer is because it has been signed, and this is one of the ticks is the X-ray. So now let's read the option. Option C, because seems like option C is the right option. Okay. Now, proceed with the radiographs as permitted since does not override implied consent. That's wrong. Defer the radiograph. You don't need to defer it. Proceed if the written consent pack whatever, keep it guys, okay? It's still readable. Included agreement for intended procedure. What does it mean, guys, intended procedure here? Language is very important. Language is very important. What does it mean, the intended procedure? The X-ray, right? This related to this. So as long as they take the small square in the pack, in the consent pack, yes. Now we can take X-ray without a second consent. You don't need a second consent. Refer the child to public dental school, wrong one. Continue the checkup and wait for written reconfirmation. Why? You already had one. You already had one. Why you should take another one? But if you're going to do any further treatment, extraction, any type of pulp treatment, restoration, and they require another X-ray for a treatment, not for assessment, in this case, you need to get another consent. But for today, for the assessment today on checkup, you don't need. Guys, I hope now it's clear. Good. It's good. Then answer is C child. Next question. Tom is anxious. Easy word. About his feeling. Teacher asks if his pet cat, the cat, can stay with him in the dental surgery. What is the most appropriate response? Definitely, we need to be very gentle and nice to Tom, right? And then nicely and politely explain and decline because of infection control. We not allow pets as a pet as long as it doesn't hurt, right? Yeah. So in this case, we don't allow. So the answer is C child. This was the structure. I believe most of you has answered A alpha. When I looked at your answer, guys, in the mock, I found most of you actually answered A alpha. But now I think you have done your research and then you end up with C child, which I'm very happy, very proud of right now with C child. Okay. Can we delete this? Yeah. Mrs. Elaine. The first question. What is the most likely primary contributor to the current clinical appearance of the denture-bearing tissues? Okay. What's this, guys? Yes, if it is a service animal, if there's any service animal, this is definitely very well trained. And then the patient will rely on it, say, yes, it can be animal. There's A plus, right? A plus fasciatum. Good. Thank you, Dr. Arsh. Dr. Arsh says it's A plus fasciatum. Very good. Now, the question asking about, guys, keywords very important. Keywords very important. Primary contributor to A plus fasciatum. A, irregular denture service. Yes, this is irregular. This area may be irregular area. From fractured flange, which is area fractured, and suboptimal Mechanical cleaning. It can be. This is correct so far. Progressive alveolar bone loss. Yes. Affecting denture adaptation. Correct. So far, it's correct. Insufficient dental care. Practice, coupled with inconsistent long-term professional oversight. Continuous overnight denture will leading to chronic mucosal inflammation. That can be true. Very tricky, right? All of them seems correct, all of them. Age-related mucosal fragility contributing to localized tissue reaction can be found. Well, seems like A, B, and C and D and E, all of them correct. Now, I see most of the answer is A alpha here, Dr. Femina. A alpha. Dr. Shelba say, I choose B. I thought it was referring to denture stomatitis. Two conditions. Okay, current clinical appearance of the denture bearing tissues. You know what? Let's add plus denture stomatitis as well. That's okay. Okay. Dr. Mossad mentioned A alpha. Dr. Siva B Bravo. C Charlie, Dr. Leo, Dr. Jalish D Delta. Dr. Bevek C Charlie. D Delta again. Yes. I know. This question, one of the questions, really need to think practically. It's a very simple question, but just need to think about it practically. Okay? Now, a regular denture surface. Let's think about it more clinically, okay? Delete this first. Let's talk about Acros fissurale and also denture stomatitis. Can these guys tell me what are the primary contributor to these two conditions? This plus denture stomatitis. What are the two main? There are lots of contributors. They will say, you will tell me, hygiene, retention, like lack of retention, and then uncontrolled diabetes as an immunocompromised conditions. So denture care is important, and hygiene, and then definitely retention is very important because lack of retention can result in, because this happens mostly post-trauma, right? There's traumatic lesion. So it mainly happen because of trauma. Denture not stable. The denture is not stable. True? So now mainly I'm looking about two things. One, trauma, because lack of retention. The other one is denture hygiene, because denture hygiene will result in denture stomatitis. Two things, not only one. So now, irregular denture surface from fractured flange and suboptimal mechanical cleaning. Suboptimal mechanical cleaning is only one thing in denture care. Denture care means you really look after everything. The secret here is the word care. Because when you care about the denture, you will do everything right. Here, it's just only one specific point out of the whole care. That's why it looks fine. It's true. It's correct. But it doesn't involve in it everything we want. Care has anything in it. Means patient will take it out before they sleep. They will clean it nicely with water and soap. Water and soap. And then they will go to dentist, and then on regular basis, and then dentist will reline it. So will not be any more loose denture. This word and this part. So this is mainly, it can work only as one out of many things. But this is involve many things. This is the best option out of the rest. Now, progress over bone loss gradually, affecting denture adaptation. That's true. That's true. But why this has happened? Why? Which one was? Now let's apply the other concept, which is, guys, which I believe you know it by now. Which concept I'm going to apply right now for this option? Let me check if someone of you wrote down this. So we're looking for another concept called cause and effect. Which one, guys, is more powerful? Is it cause? Because now we're looking for the cause, primary contributor. Now, which option of this cause and which option is the effect? Yes, hygiene is one of the things. Very good, Dr. Rabi. Cause and effect. Which one of here is cause, which one effect of these two options? Definitely. F, because this is a cause. C option is a cause. Why it's a cause? Because which is contributor. Cause means like this is a contributor. Because if the patient insufficient denture care practices means the patient doesn't care, right? It could be, for example, who's doing some hygiene like cleaning stuff, but he's using vinegar, for example, which is not right. True. And then coupled with inconsistent long-term professional oversight. What does it mean? He doesn't go to dentist. Imagine that. If this patient goes to the dentist with inconsistent long-term professional oversight, like he doesn't go back to dentist to follow up. Imagine if he goes to dentist and if the patient cares, do you think he will end up with some optimal mechanical clean? I don't think so. Because he goes to dentist, dentist will clean it nicely for the patient every 3 or 6 months, and then he cares, and then the patient cares, and because the patient cares, will be doing great job. Progressive alpha bone loss, do you think if the patient cares and he goes to professional oversight, like to dentist, do you think what can happen there? Dentist will reline it. And if the dentist relines denture, never get this. Apply the same things, guys, into D&E. Am I good, guys, about this point? You know what? This question is exactly like this. This type of questions, it really does need you to think more clinically. Like which one of these, if the patient asks my advice, patient, now let's reverse somehow. Let's reverse. Guys, am I still guys, am I still live? Okay, that's good then. Okay, now let's, guys, think about it more clinically. If the patient tells you, I need only one advice, like it's a new denture, a new denture, and the patient tells you, doctor, I have my friends, and my friends got 2 conditions. One is A+ fissuratum, 2 is denture stomatitis. What is your advice to avoid these 2 conditions to happen? Which one of these, guys? Basically the scenario, because scenario matching on this. That's, guys, the easiest way to understand this. Now tell me which one of these is going to be your advice. When you explain to them the pathophysiology of this condition, which one of this option will be the best for the patient? Okay. Now, if you think about it this way, you will understand which one is the primary. If the patient has done it from the beginning, that's all will not happen. Did you get it right now? If the patient, the advice you're going to give to the patient to avoid this to happen, if the patient follow it nicely from the beginning as a primary contributor, that's a primary. That's the first thing. That sequence here to play work. Sequences. The sequence. What has happened before what? This has happened before this, before this, before this, before this. If this has been nicely made, you'll not get any of this stuff. Because you know what? Dentist will fix it straight away. Broken fracture. He cares. Patient cares. He goes to dentist. Then straight away, second day, first day, he cares. Goes to dentist. What dentist gonna do? Gonna fix it straight away. Never happened. Guys, I hope now critical think is something very important. I know for you, maybe still think A is right, B is right, D is right, E is right. Think about it again, you will get a point. Okay. Now, I will repeat this again because I know I may have some confusion here. Let's say alveolar bone. Why alveolar bone happens? Alveolar bone resorption. Why they happen? Because of what? Why alveolar bone resorption can happen? Because no relining. Right? Because raw relining. Why no relining? Because patient doesn't care. Because patient doesn't have inconsistent long-term professional oversight. Guys, is it clear now, guys? Is it clear so far? Okay, I hope that's clear right now. So right answer is? Right answer is? Dr. Arshino, you still confusion. Dr. Taslim, yes, clear. Dr. Shank, yes, clear. Got it. Okay. Dr. Pasarat, yes. Dr. Anubrea, no. No, doctor. Yes. Dr. Kanika, C, yes, very good. C, very good, guys. Now, Dr. Arshino and Dr. Anubrea, okay? Now, imagine right now, to prevent this to happen, it's something your mom, okay, comes to you, maybe one of the family, and tells you, my daughter or Arshino, I got this condition right now. What's your advice? Which one is going to be your advice? Is that because your advice is fix this, you will be fine? Just do a little bit clean, you will be fine? No. Because next time, she will not be fine. Because she needs this. Oh, mom, yes, it has happened because bone, like your bone has been eaten away. And that's why affecting the denture. Okay, go to the dentist now, clean it, or the dentist will reline it, and then they will not do this. What's gonna happen? Back again to this, and denture stomatitis. So this, if it has happened from the beginning, from the first time, from the first day, this will not happen. I hope it's clear now about the primary contributor. Things has been done. Primary means first. Primary means first. As a sequence, first as importance or significance. Primary means cause and effect, like the cause comes first before effect. Guys, you have lots of options here. You can choose any one of these. Think about any one of these. You'll find, do see, nothing will happen. I hope it's clear now. Okay. Okay. I'm happy, guys, that I see some of you right now got it right. Again, after finish the smoke, go back again and think about all the stuff slowly, more clinically based. When you think about, because these options exactly like this, I tell you something, I tell you why you are confused about these options. But I love, guys, your confusion and then things which I love it. When you think, when you get out of your comfort zone, I love it. Because you learn, right? Now, option A is like this. Option B, it's like this. Option D is like this. Option E is like this. Option C, just here. Which one, guys, is taller? Which one is higher? That's A, B, C, D, and E. Which one's higher? Which one's taller? C. C, just. Just. This is correct. That's not wrong. I told you. That's not wrong. This is all correct. But C, just. That's why it's called the best option. Because all of them can be correct, can be right. As this. Okay. So the answer is C, Charlie. Now, this should be easy now. This question should be easy. The question asking about, now, yeah. The question asking about yes, two contributing factor to retention. Now we're talking about retention only. Again, think about it clinically. Something you don't have it, regardless the reason behind it, right? Finally, you will not get retention. What think the answer, guys? Guys, am I still live? Guys, am I still live on Facebook? Yep, okay, very good then. I'm very happy now. Every one of you says be bravo. I'm happy for be bravo. You're doing great. Easy now. Why no retention? Because inadequate preferred seed. If there is preferred seed all around, if there is, or there were preferred seed all around, retention will be perfect. Easy. No hard, right? You may choose, guys, D delta, right? Okay. But D is the main reason and the B is the effect, Dr. Muhammad. Look, guys. Language again. Language. Dr. Muhammad says, but D is the main reason and the B is the effect. Dr. Muhammad, think, okay? Think right now with me, okay? Let's think together. Severe alveolar ridge extended to the post-dam region. Do you think the ridge meeting the palatal post-dam region? Do you think the ridge, do you think this part is a ridge? Is a ridge or soft tissues? Post-dam. So ridge resorption, there's here hammer and notch. There's maxillary tuberosity. There's a tuberosity, right? That's all mucobuccal fold. The ridge ends at the mucobuccal fold, not the post-dent. Post-dent is soft tissues. Did you get the point? So this is not right, but this is true. Good enough. Dr. Shelton, you mentioned your comment that Ibrus fasciatum is also a reason for inadequate retention. No, it's not a reason. What has happened is, Dr. Shelton, denture was irretentive in the beginning, loose, trauma start to happen, because, okay, one, I think, guys, we're going to only finish 2 scenarios today, right? One, patient didn't care. 2, no relining, like didn't go to dentist, no dentist. 3, no relining. 4, ridge resorption. 5, trauma. Then at the end, this happened. Ibrus fasciatum. So Ibrus fasciatum is a reason because of, ridge resorption, no retention, trauma, because no retention, Ibrus fasciatum. However, it's a way around. Ibrus fasciatum, it does help the denture to retain. Imagine, because it's a pocket. Denture goes here, soft tissues, like a bulk of soft tissues, denture stick to it, it's loose. As in, you have a loose dress, and then you put weight, you wear the dress, it fit nicely back again. That's happened. That was very thin. Some soft tissues make it big. Denture now sit on the soft tissues, it retains the way around. Guys, please, read this topic again, okay? This is the way we all read. When you are thinking, you have too many thoughts in your head, you go and read more, and then you understand more. Okay. Guys, what's the answer to this question again, to confirm? Guys, what's the right answer? B Bravo? Guys, the challenge, guys, has answer B Bravo. How do you know? It's very still hard question. I'm really proud of you if your answer was B Bravo from the beginning. Was it, guys, your answer from the beginning? I'm really, guys, proud of you. You know what? What is the most appropriate immediate step in managing the patient today? Guys, what we got the right answer here? Okay. Guys, I think, guys, what's the right answer? Question 3. I'm happy, guys. Most of you answered C. Charlie. Dr. Kanika, C. Charlie, I'm very proud of you. Dr. Mariam, I'm very proud. Dr. Dalji, very proud. Dr. Arush, very proud. Dr. Keratam, yes, you're very close to it because, yes, definitely E can be right as well, Dr. Keratam. C. Dr. Shamza. Uh-oh. Why? Comes again. Okay. Okay. Now, think about it clinically. The only thing, guys, that when you miss the right answer, because when you think clinical, now, what is the most appropriate immediate step? Imagine this patient. Why this condition has happened? Guys, why the condition has happened? The denture now, denture is in your hand. You put in the patient mouth, fold. The patient, not the patient folds, the denture folds, right? And the denture folds, what does it mean? Loose. When it's loose, this is all gonna happen. So what is, right, as a part of the pathophysiology? Pathophysiology starts from patient doesn't care, didn't go to dentist. Dentist didn't do any relining, because no relining, denture start to be loose, traumatic, bone resorption. Denture is loose, bone resorption, sorry, traumatic, then start to result in traumas around the tissues. Now, if you fix something today, something the patient missed it because he didn't see dentist from the beginning, you will reduce the trauma. If you go and do something today, we'll reduce trauma. Because if option, let's say, option A, proceed with primary impression, totally wrong. You don't need primary impression for new denture. Not today. That's not right. Postpone all procedure, all, no right word, until systemic conditions are fully stabilized and recommended. How is this? Why? Advise patient to maintain her current hygiene routine until reassessment. Okay. When going to be the reassessment? Do you expect this going to happen? After 2 weeks? 2 weeks. Imagine in 2 weeks, patient does need for denture or not. Think about it clinically. Patient comes to your clinic, tells you, you tell him this way. You guys tell them, D delta. You know what? Advice to current hygiene, clean it, clean it. Don't wear it. Don't wear it. I don't know if they accept don't wear it or not. It's impossible. to tell the patient don't wear the denture. Okay, wear it. We have now two options. One, don't use the denture. The other one is to use the denture without relining today. Without relining. Do you think both any one of this correct? Tell the patient, sorry, we cannot give you the denture. Sorry, don't wear the denture for 2 weeks until you come for your assessment. Or delay all treatment until mucosal healing. Mucosal healing, it needs for after biopsy, because you can do surgery and biopsy, maybe 6 to 8 weeks. Imagine. Now tell me guys now, are you happy to tell the patient don't use the denture for 8 weeks or 2 weeks or 6 weeks? Put yourself in patient position. Think less clinically, not theoretically. Easy now to understand it. Again, what happens is right? One, denture is not stable, loose. Then trauma has happened. You need to reduce this trauma. What do you need to do? Repair the denture, reline it. Then plus tell the patient, improve hygiene. Don't use vinegar every day. You don't need to use vinegar every time when you brush it. That's too much. Twice the vinegar, too much. That's not good hygiene. That's not good practice. Then take the denture out. Use it when you want to eat, only when you want to go out between people. Let it outside dry before you sleep. Which option now the best, guys? And then later on, when things fixed, I can take an impression later on for other things. If you're still happy with A or B or D or C, it could be fine, but not the best answer. So think about it, patients cannot live without the denture. He wants the denture back. He wants smile still. They want to eat. They want to go outside between people. Okay. You know what? Do whatever you want for this patient, but don't let him to go away from your clinic without denture. Do whatever you want. Because if you're not giving him denture, he will kill you. He will not, he will never come back to you again. Okay. Guys, what think the answer here? Okay, guys, this question is just mostly theory question, okay? Pain, actually still clinically, honestly, during insertion and removal. Pain is during insertion and removal. Why is this? I check in your answer here. You're doing very good, doctor. Guys, I'm really very proud. There are most of you guys doing good. I have noticed most of you answered the questions right so far. But Dr. Kanika, she asked this question right. The previous two questions were right, 3 questions. Dr. Saban Preet as well. Dr. Shriyanka. Dr. Muhammad. Well, very good. Yes, you have an undercut. If you have undercut, like let's say a big bulb, you see like a big pulp or bulge, like let's say a bulge, like a swelling like this. Every time you put the denture, it hurts. Take the denture, hurts. Why put the bulge like it's undercut? Right? Easy one. Answer D delta. You need to be safe dentist, right? You should be safe dentist, guys. What do you think the answer here? You be safe dentist. Guys, I'm very happy. That's the answer B, bravo. Because definitely you need to get peace of mind. You don't know what this exactly can be something differently, right? This is going to put you in safe position. And the patient in safe position, you must be safe dentist. By the way, if you see this word in exam, choose it. Mostly the word histopathological examination or biopsy is correct answer. Now, what think guys answer this question? Easy, right? In Australia. Australia is very generous. They actually can provide or actually provide free professional interpreter. Why not use it? Why not? This is not right. Because no professional. You may say something not correct. But the professional interpreter, he knows how to do it. And for free. Why not? Guys, what's the name of the organization we have here in Australia for this? What's the name? Start with N? Or start with T? Which one? Okay, good. You got both of them right. But we use TIS more than that, okay? Because nothing more into examination stuff. But TIS, it's more common, okay? Okay, answer is, we mentioned C. Charlie. Next question. Guys, what think the answer for the next question? Shows sympathy? No, we never show, guys, we never show sympathy. We show empathy, not sympathy. So that's wrong. Keep questioning a brief to avoid overwhelming the interpreter. Why the interpreter would go overwhelmed? It's his job. Wrong. Avoid overwhelming the interpreter. People choosing B still. Guys, please read properly, okay? Read the question, the option about the interpreter. No B, please, guys, okay? Use standard intake forms without modifying the process. Distractor, it doesn't make any sense, anything. Yes, always encourage. If you see this word in the exam, by the way, I will have one session soon about build technique, right? This is, I think, will be private. The build technique. I will explain all these points one by one. As I say, even if you have totally new information and new topic, you will be able somehow to reach at least 50% or more than this based on the technique itself. It doesn't mean you shouldn't read, you must read. And that's what we do right now, right? We must read, we must be strong, we must learn new things every day, we must be a good dentist. Right? Yes. But this somehow can help you, just in case it's new topic, new question, you're not aware about it, language part. Okay? The word encourage, if you see word encouraging question, an option, mostly right. And the concept is right. Because you still need to hear from the patient. You still need to build up rapport with the patient. To build up rapport, patient should talk to you. And you talk to the patient. You must encourage patient. Like, talk to me, I'm listening to you, I'm here, take your time, this stuff does. I know you may feel not good right now. If you want to talk, I'm happy to talk. If not, we can do it next time. We can take it slowly. Otherwise, you will not be able to build that rapport with the patient and to understand them more. Answer is D delta, okay? He's eligible for public dental care as entrant in his complex dental needs. Okay. What does you think the right answer here? guys has pain? Pain is emergency. It needs treatment, right? He really needs treatment. What do you think? Very good, guys. You know what? That's really amazing. I see most of you guys provide the right answer. I'm very happy with this. Everyone now, most of you guys say sick challenge. I'm very happy. Public list, not right. Waiting list, not right, because he's in pain. He's in pain. Do something. Emergency, do something. Ah, that's true. No, because we already said we're going to get interpreter. Wrong. C is correct. He's in pain. You cannot do this. What? It's not our scope anyway. C is the right answer. Next question. Guys, what do you think, guys, the answer for the next question? I love this. I love guys who got the right answer. Explain each step, maintain upright position. Why? Because when the patient upright position, then you have, because when you put the patient in upright position, we have what we call it as eye contact. Body language, eye contact, eye level like this, so you can talk. That's the best. When you talk to someone, means that you really care. I explained this before in details. Last question, this scenario. We're very close right now, guys, to finish. Look, I believe you will answer this question not correct, which is okay for me. I know your answer right now will be E echo, right? Or D delta, or B bravo. Imagine so far. Guys, am I audible? Guys, imagine so far, no one has provided the right answer. Imagine this. Composite restoration. We're talking about composite restoration. Okay, guys, everyone, please, guys, like Dr. Taslim answers, please. Please, guys, everyone likes Dr. Taslim's answer. and Dr. Rabi's answer, and Dr. Allen's answer. Imagine the answer is A alpha, guys. Oh, Dr. Brazo, you are great, Dr. Brazo. You're right, Dr. Tipali. Guys, in composite restoration, you don't need to remove both or actually all undermined enamel. C. Charlie is wrong. If you're choosing C. Charlie, right? Wrong. Because where about, guys, where about did you read about undermined dentin? Give me one reference in this life about something called undermined dentin. Have you heard before about undermined dentin? Have you heard before you should remove any there's nothing called undermined dentin anyway, just to not go too far in this point. Okay? So defend that's wrong. When you do the cavity, the new principles, right? Now it's not very new. This is from 10 years ago or even more. You have two options. One is to remove the undermined enamel, but not the undermined dentin. There is nothing called to remove undermined dentin, by the way. Okay? It could be soft dentin. Soft, different than undermined. Okay, guys, by the way, because I don't want to confuse between both. That's correct, that's incorrect. So you have two ways. Either to remove the undermined enamel or to preserve the full thickness undermined enamel. That's two ways. Option C is wrong because of this. And also, think about it. If it's your tooth, and you have two options. One is to prevent the enamel, the full thickness enamel, even undermined, and then fill it from down, because when it's undermined, when you have, like here, let's say you have a tooth like this, and then I don't know how can delete here, I don't know. Anyway, and then you have undermined enamel here. This one is undermined, all this undermined. You know what we do? We just put GIC here. We put GIC here. Now, the whole undermined full thickness, that's full thickness. This part called full thickness, because you didn't remove from the full thickness of the enamel. Now, dentin, we push the dentin down, okay? Below the cusp, undermined cusp, full thickness. Now, the enamel will be protected again by dentin, the GIC, because GIC is very close to dentin. They're very close in their features. GIC has mostly same features like dentin, except defense sensibility. Answer, guys, A alpha. Please read more about this point. Okay, guys, if your answer was A, how do you know? It's only, I have seen from the answer only 3 or 4 only champions they answered A. How do you know? Doctor, yes, doctor, I mentioned undermined enamel different than, sorry, there is nothing called undermined dentin. There is nothing called undermined dentin. There is no anywhere mentioned. You should remove undermined dentin. The word undermined, it doesn't mean soft. Undermined means not supported with the underlying tissue or lid, like enamel.
supported by dentin. Enamel still hard. Remove dentin totally, still hard, but unsupported. Right? Dentin, there's nothing called answer. I haven't had, in my life, I'm not sure about if there's something called undermined dentin or not. I don't think so. Right? Even though, if it's existing, we don't remove it. As long as hard, undermined doesn't mean soft. Undermined means not supported. Soft means fragile. Okay? That's two different things, please. You don't need to remove all undermined enamel. Okay, now, let's say this is true. Let's say this is true. And this one true. Which one choose it for yourself? You have now two options. It's your tooth. Your tooth. And this is correct criteria. The tooth will be perfect after this. No issue. And the other one, this. Perfect, no issue, which is remove all undermined enamel. Which one are you going to keep it for yourself? Tell me. If my tooth, I have big crown like this, but it's all undermined from inside because the dentin was all soft down there, the dentin, but enamel was actually very thick and nice, but not supported by dentin. Dentist gave me two options. He told me, the dentist, I have two options now, either to remove all the undermined cusps, and then you may end up having onlay or overlay or crown, or I can fill down there the full thickness undermined enamel with only GIC, right? And both of them works fine. Which one you want? To go to crown option or just filling down there? Tell me now your answer. Clinically. Please, guys, go and read more about this part. Again, the same question. Dr. Bahano, only if it is not full thickness. Guys, do you have ADC criteria with you for part 2, guys? Do we always preserve undermined enamel or just in case of composite? In composite, we can preserve the full thickness, not every undermined enamel. Should be full thickness. Should be full thickness. This can be preserved. If it's not full thickness, you cannot preserve it. You must remove. Please, guys, if I missed any of your question, you can retype it back again. I'm trying to catch as much as I can from question, guys. Okay. Can any of you guys access right now ADC Part 2 criteria handbook in composite restoration task? All the way down, the last criteria, it's about this point. Dr. Musa, can you please do something for me, please? Can you please access in Google right now? Look, I have Facebook open, Zoom open, Google opened here, in here, my laptop and everything, right? I only want you, please, if possible, if you want really know. If you don't have time or maybe you're busy, don't know it now, go on our website, ADC handbook criteria for part 2, composite, the composite task, all the way, the criteria number 15 there, the last criteria number 15. It's all about undermined enamel. You can go and read it now. Please, guys, let me know what did you read there. If anyone, I know, guys, some of us very fast, very fast. Someone, guys, please fast can tell me yes. Some say yes. I read it right now. I went there. I checked it. I found it. I got it now. Okay, that's, guys, the best way to get it, please. Okay, this example again. While going to search and come back to me and let me know and let everyone know. Right now, this is what is this, guys? What is this outmost layer? Thank you, Dr. Musa. Guys, what Dr. Musa, because I will explain this to you again, Dr. Musa, and everyone, guys, didn't get the concept. Okay, Dr. Shania, I will explain this to you again. That's enamel, right? Between enamel, let's say, what is this, guys? Blue line. Yes, Dr. Sando, very good. Yes, Dr. Sando, you're totally right now. Yes, for amalgam removal. But for dentin, keep it. Because dentin are very conservative in it. And we need to get proper bonding from enamel. Guys, what is, guys, this blue line? The EJ, right? Into enamel junction. Very good. Now, imagine the green of the enamel. Is it full thickness or is it complete? Is it full thickness? Enamel or not? Please, guys, everyone can please like Dr. Selby. Please, guys, everyone, please, guys, like Dr. Selby, guys, okay? Dr. Selby comments, okay? Okay, great. That's all thickness, right? Now, you have an excavator, and then you excavate all this dentin. You excavate all this dentin. It should be red. All this. You excavate all this dentin, guys. Now, there is no anymore. I think I can delete this. Anyway, there is no anymore. Sorry, guys, I need to get this one. Not all of this. See? It was fine in the beginning. Delete all. That's fine. Okay? Now, there is no anymore dentin. Only enamel, which is purple in color. You have now two options. One is to remove all this cast because it's undermined. To remove this cast because undermined, and then the tooth will look like this only. And then this is gone, not existent. So you have maybe tooth only look like this. Or you fill, you keep this, keep it, perfect. You fill it with preserve it, and you fill it with GIC from down there as long as full thickness. Which one will you do? I know, guys, today you learn new things. I know this, and maybe too many informations in one go, right? But again, as I said before, I like you to get out of your comfort zone and learn more things. I'm very proud of you guys. You get the right concepts right now. I'm very happy. I hope, guys, it's clear right now. Which one do you like? Do you like to choose A? A or B? Which one? You can choose for your tooth, A or B. Preserved. Should be full thickness and preserved. Guys, A is to remove the cusp, remove the cusp. B is to preserve the cusp. Which one? To remove the whole cusp and tooth only look like this? Or to preserve the cusp and looks like this? To preserve the cusp like B or to remove it like A? Which one? B, right? For myself, it's B. I will preserve my tooth. I will not remove the cusp because if you remove it, the restoration won't stay here unless you redo crown. Anyway, answer, guys, was A alpha. Guys, what's the answer for this question? Is it A or B or C or D or E? Which one? Patient anxious. What do you think? Patient anxious. Why E, guys? Why E? Why you rely on a specialist in this? Why? Why you cannot do it on your own? Why not brave enough to do it? Why not confident about yourself? Okay, guys, give me explanation, please. Why do you think it's the right answer, please? What could be the reason for E? Like what? Again, think about it. Is nitrous oxide, is it our scope or not? Yes, it's our scope. It's just only 1 day course. 1 day. We should encourage the junior dentist, the recently graduated dentist, to do the 1 day course, and now they are competent to do nitrous oxide. We need lots of dentists in the country. They know how to use nitrous oxide. Nasal congestion, I'm happy now. If you go with nasal congestion, I'm happy. Now there's something going on. There's nasal congestion. Right? In this case, if there's nasal congestion, I agree to you. Now it does make sense more than D. Why? Because nasal congestion can be contraindication. Asthma, it's on, it's not. Asthma, it's okay. Maybe severe asthma can be a problem. But yes, I agree to you. If nasal congestion is existing, in this case, Y2S, I agree. E echo is right. However, still our scope, but E echo does make sense because now there is circumstances makes us to consult specialists. You're right. Yes, we can. Yes, but because patient actually, or the child has nasal decongestant, so every time you put the mask or the gas on the face, it will not be right. Okay. Given that the patient's high risk, which toothpaste you will consume, guys? Which toothpaste? Guys, what's the right answer here? He is 4 years old. So we have 0, guys, beta bytes. It's already mentioned there in beta bytes. Okay, if you remember. This all the stuff, guys, in beta bytes. Even I uploaded a file for fluoride about 2 days ago. It has even some information about this part too. He is high caries risk, guys. He is high caries risk patient. And he's 4 years old. So 0 to 18. And then 18 months to 60 years. Normally, 550. Normally. But now it's a high risk. So either to use this more frequently, like instead of two times a day, will be 3 to 4 times a day, or you jump into 1000 ppm twice a day. Guys, do you think this patient has a high case risk or not? Very good, Dr. Shelpa. I love this. Good on you. I love when you have the complete information. How many cartridge? Before you answer this question, tell me in Australia, which carpool we use it most of the time? Is it because there are different carpools? There's 1.7 ml, there's 1.8, that's mostly in UK and US, and 2.2 ml. Which one guys normally use in Australia? Wow, Dr. Rabbit, great. 2.2, right? So our calculation here will be on 2.2 ml. Yeah, we have some of 1.8 still in the clinic, like I have both. I have 1.8 and I have 2.2. But let's do calculation about 2.2. On 2.2, how many cartridge? That would be very tricky right now. Look, guys, this will be very tricky. I know most of you between 3 and 4. When you calculate it, look, I made it intentionally this way to teach you a concept. Easily. If the patient is 20 kilogram, if the patient is 20 kilogram, we provide the patient with I would say 3 carpols steel, 3 cartridges, like this one, if 20. If 30, we provide 4. So now we are between, should we provide 4 cartridge like 30 kilogram or 3 cartridge like 20? Which one safer? Because by calculation, you will end up with 3.9 cartridge. 3.98, even 3.9. Like only 0.2 to be 4 cartridge. Which one are you going to go with? Which one more safer? 3 or 4? Safer. As long as we reach the maximum, the maximum safest limit, you cannot choose it. There is a maximum and a minimum safest limit. If you don't reach it, you cannot choose it. Easy concept. If your answer is 3 cartridge, you're very safe. And this is the right answer. If your answer is 4, you must somehow, you got most, I would say, lead with the result itself, which is 3.9 cartridge, but not 4 yet. If the patient's maybe weight is about 26 kilogram, I believe in this case 4 will be enough. Imagine 4 will be fine. Yes, 1 kilogram. Because you cannot be 3.9 and we say 4 carpols. You cannot. You cannot. Guys, do you know guys about this? If there's any formulas, you can find it in TG. What you can do is you multiply 25. If you want to calculate this way. Multiply 25 kilogram by 7 milligram, which is the maximum dose for each kilogram. It means this child should get, guys, what's calculation here? 25 multiplied by 7. That's a maximum they can get from lignocaine. Let me calculate it. $175. So the child can get 175 milligram for each milliliter, which is the maximum of lignocaine. He can get altogether 175 milligram of lignocaine. And then after this, let's now divide the 175, because the carpool has 2.2 multiplied by 20 equal to 44. So now every one carpool has 44 lignocaine, has 44 milligram of lignocaine. So now divide 175, which is the maximum the patient can get in his body, divided by the 44, which is every carpool has 44 in it. Now I can give you how many carpools. How do they get the 44? You multiply the milliliter of carpool by 20, which is milligram, which is a concentration. It gives you 44. Now, guys, how much it is? Let me calculate this. 175 on 44. 175 divided by 44. Imagine 3.97. Is it 4? Is it equal to 4 or less than 4? Is it equal or less? This is the right answer, okay? Is it equal or less, guys? I like your answer, Dr. Shelba. It is equal to 4. How come? Imagine right now, Dr. Shelba, right? If you are going to sell gold, okay, Dr. Shelba? Dr. Shelba says equal to 4, but we choose less. Okay. Now, imagine now you're going now to buy, actually to sell, no, to buy gold. The guy for the gold, the jewelry guy, the journalist, whatever they call this guy, right? He gives you 3.9 gram of gold, and he tells you you need to pay for 4 grams. Will be happy? Dr. Shanta will be happy. Okay, let's round it off in the gold. And instead you pay for 3.5 gram, you round it off to 4. We'll be happy to the guy to round off for you to 4. So it's not equal, okay? Let's agree it's not equal. 3.9, 3.97, not equal to 4. Very good. So it's less, okay? Let's agree on this. Answer, guys, A alpha. Next question. What's the answer, guys? Next question. This one is the easy question, right? This one is very straightforward, easy question. So which one, guys, the right answer here? There's one of the easiest question, and by the way, theory information, you don't need to think about too much. You can read this in any book, guys. C is right, okay? This is like book's answer. If you read a book, you remember this answer, you go to exam, just answer. There is no clinical judgment or any critical thinking in it. So C was the right answer. What think, guys, the answer for question number 5? Guys, what think, guys, the answer for 5? If you work in Australia, right? If you guys work in Australia for question 5, you will know what's the right answer. For question 5. I see answer for question 5 is between A, C, and E. Which one, guys, the right answer? B, bravo. Your diet supervision. You know, guys, I'm very proud of you. You know why? Because it's more than now 2 hours. It's about 2 hours and a half right now. And you still existing. Did you get tired? Guys, did you get tired, guys? Please, guys, always in this type of questions, you must or should use the sequence, the right sequences, guys. Please think about it. Which one comes first? Which one is more important? Which one comes first in this option? Think about it. Which one, if it doesn't work, the second one will not work. The third option will not work. So we need option this first, then option this, then option this, then option this. Not tired. I'm very happy, guys. I see you're not tired. You're learning so much. I'm very happy. Dr. Rabi, I'm not learning new concepts. I'm very happy. Learning so much from this session. I'm very happy, Dr. Shriyanka, to read this. I'm very happy, guys. You're not tired. You're still alive, Dr. Shabin. Very good, Dr. Shabin. So now, guys, the right answer actually is E echo. Because without E, the therapist cannot even enter inside the clinic with a child. Imagine, she cannot. She cannot even work for kids. So we need E first, then like this first, then this, then this. This is wrong. Risk assessment of wide dental units. This can be even second or something, but not directly related to here, because it's not her job anyway. It's not our job or her job or anything. I mean, not the one responsible for. Yes, Dr. Razo, you're right. But imagine if this not okay. Let's say you think about this way. You already, Dr. Razo guys asked question, but shouldn't we take consent from parents to involve therapists? Let's do this. What is this, guys? What is this? This is consent. Who's this? That's a parent. The parent now sign the consent. Who's this? Who's this? Dentist, right? The parents signed the consent. You took the consent. Thank you. You gave me the consent. Dental therapist. Yes, doctor. Can you please treat this patient? This baby? You know what, doctor? Sorry, I forgot to tell you something. What did you forget? I don't have valid police check. Bye-bye. Easy. Sequences. One of the best concepts. Sequences. Tricky, huh? You need this first. Once it's done, you can move to this. I hope now clear. First question, guys. Answer first question, please. Okay, guys, what's the right answer? B, bravo. I love it. Easy. The word absolute or absolute made it wrong because it's not an absolute contraindication. The question is not correct. The question, not correct. So not correct is absolute contraindication based taking medication for high blood pressure. Not absolute. It's relative. Relatively, not absolute. Okay? So B is wrong. This is correct. There's the wrong, so that's the one I need to choose. Guys, how was the session so far? How is the mock so far? Too many things, right, to learn, huh? Too many things? You know, I still really enjoy. It's 2.5 hours now, I believe. I feel a little bit tired, but I love it. I enjoy it still. I hope guys enjoy it too. I feel happy when you have new thoughts, new ideas, new information. Yep, you're right. Thank you, Dr. Niba. Thank you. Those are really looking very smart. Thank you, Dr. Niba. I'm blushing now, Dr. Niba. Thank you very much. Thank you, Dr. Penny. I'm very happy to see your effort you put as well, Dr. Penny. Thank you very much. Dr. Zara says, don't even realize it's been 2.5 hours. Imagine me too. I just look at my phone battery right now, it goes down. So I looked at the time, I found 2.5 hours now. You cannot sleep tonight, right? You know what? What if we stop right now, guys? Can we stop at this question now? Take care. Thank you. I love this Dr. Shariasi. You know what? I will give a big heart. She's saying, take care, doctor. Is that for me or for who? I thought it's for me. My shit looks good. That's okay then. Thank you for this. Okay, just guys, I was kidding, guys. There's only a few questions left. Next. Guys, what think has the answer to this question now? Guys, what's the answer to this question then? Who's guys Marsh candidates? Actually, that's okay for Marsh candidates. I believe Marsh candidates enjoying now, right? Enjoy very much in the course. September candidate are under too much pressure. That's why they can't sleep. Everyone say, please answer, please answer. But Marsh candidates, they should enjoy it right now. See, Charlie? Don't worry, just only 4 questions left. Easy. If you answer C, Charlie, you're very right. Stop the procedure and carefully remove the needle from the mouth. Yes. Imagine this right now. He just start to feel lazy. And then he's telling you like, I'm lazy, doctor. You cannot proceed with injection, right? You need to stop. Take the needle out. That's it. Any other things? Recline the dental chair to horizontal position? Hell. You need to stop first, then recline. You're gonna recline it while the needle is inside? Not correct. A is not right because the needle is inside. Question 3, guys. What is the answer? Question 3. Question 3, answer is he actually regained his consciousness immediately after you reclined the chair back. If it was allergic reaction, I don't think at all that would be enough to regain his consciousness. Orthostatic hypotension, it takes more time than this, and the patient doesn't have, I believe, blood pressure issue here. So be bravo, it's not right. Cardiac arrest will not be easy to regain his consciousness straight away. Acute adrenal insufficiency normally doesn't happen during the treatment. Normally happens 12 hours after the stress, the physiologic stress. So the right answer right now is E echo. E echo is the right answer. Now it was vasovagal attack. What do you think the right answer for vasovagal attack for question 4? What are you going to do? Tell me. Tricky, very tricky question. What are you going to do in this patient? Mr. Arnold tells you that he feels okay now. How will you care for this patient today? We care. How will you care? The question asking about care. You care about someone. You care about someone. How do you care? Someone you care about someone. Someone just have vasovagal attack right now. And he is old guy. Vasovagal attack. He's old guy. How old is he? 87-year-old. 87-year-old has lots of complex medical condition, include hypertension, allergies to penicillin, he's old. And you care. I'm not asking about treatment. The question doesn't ask about treatment. Even the question doesn't ask, what will you do next? Okay, guys, if patient has vasovagal attack and he's elderly, he's old patient with medical issues, chronic medical issues, even if controlled, In this case, we need to refer the patient for medical evaluation. Easy concept. And the question asked about to care. Please, guys, it's not, don't make up things. Read the question properly. How to care. I care about it. I need to care. The question then asked about what next, or what you can do. The question how you care. As a part of care, because extraction not part of care. Extraction part of the treatment, which should be done. Anyway, all the patients plus vasovagal syncope or syncope, attack or syncope, we need to refer the patient to medical evaluation. You consider this. Answer D delta. Please, guys, check Bido bytes, check TG, check any proper source. You will find the answer. What will you prescribe today? Patient in pain, right? Patient in pain. Sorry, patient pain? Let me check. Abscess, periodontal abscess. Ooh, okay. He also reports a known allergy to penicillin. He has mild pain. The patient declines all other form of treatment and provides informed consent for extraction only. He assesses the case and are prepared to proceed with the extraction today. Okay. Are you going to extraction or not? The question is, are you going to extraction or not? And then so guys, one thing, the right answer. A, B, C, and D or E. He has allergies, right? To penicillin, also diabetes. Mild type of pain. The first option is ibuprofen, 400 milligram. Paracetamol, 6 hourly. Guys, what's the right answer? D or E? Which one? D or E? Because this patient, actually, an old patient, he went into attack, vasovagal attack. I want to do extraction today. I will be worried to do extraction for him today because he's old. If you not go to do extraction, what should prescribe? He has allergies, right? To penicillin. If he had allergies to penicillin, so in this case, okay, the critical part is he's old. Plus vasovagal attack, which is syncope. Most probably, don't do extraction today. He has mild pain. plus infection. Seems like that's going to take more than 24 hours to do extraction, and there is infection. Because there's infection, antibiotic is important. Patient has allergies to, so antibiotic is important. Patient has allergies to amoxicillin, to penicillin. So in this case, clindamycin. So I need an option. Has a clindamycin in it. Doesn't have clindamycin. No need for IV, just an periodontal abscess, like it's not for IV. Clindamycin is good, but 600 milligrams too much. Should be 300. Amoxicillin allergies. Patient has allergies. The only thing left right now is clindamycin. And the pain is mild pain. Paracetamol work fine for mild pain. Answer is E echo. We finished. Guys, how was the mock? How was the mock, guys? Do you want to get one new mock? We still have good time, right? If you really like this mock, I can do one more mock. Dr. Hami, it's localized zoonogenic infection was an antibiotic because no extraction today. As long as infection and no treatment, no bilobite, no, this is bilomath. Infection plus delay treatment equal to antibiotics, therapeutic antibiotic. Anyway, guys, do you like this mock? Should I do next time similar mock or different mock? I need your suggestion, please. If you like it, say yes. Because when I work on a new mock, I need to know. I always love to hear from you. So tell me, would you like me to do similar mock, harder mock, tricky mock, different concepts, new concepts, regular concepts? You like it, not like it? Let's see, guys. Let's read what you say now. Dr. Didi Dalmish, thank you, Dr. Didi Dalmish, thank you. Hello, Dr. Bido. You are the best. Thank you very much. You are the best because you come and attend the session and stay for more than 2 hours and a half. This was really an eye-opener for many small concepts. Please need more mocks. One more. Okay. I put this in concentration. In concentration, sorry. Yes, similar to this, please. I'm happy to read this. Yes. One more mock, Dr. Bido. Say, please take lecture on smoking cessation therapy topics, okay? You know what? I think I can read from here. Maybe. No. No, I don't know. I can find it. I think go down, down, down. No. Maybe from here. No, sure. Yeah. Yeah, from here. I get from here. Dr. Envir lecture. Okay, that's fine. The arrangement. We can explain this in the lecture in private session. Yes, it shows how we need to think clear during exam. I guess we are rushing in exam. I agree in this, Dr. Bahan. Yeah, this private session will be. Logics and explanation are amazing. I love it. Thank you, Dr. Bido. Thank you very much, Dr. Bishkams. Dr. Yassi. Thank you, Dr. for the eye opener mock. I'm happy, guys, to know this. Answer for 5 questions. Please, guys, share the answer, Dr. Heyman, please, guys. Best mock ever? Oh, Dr. Ayushi. Thank you very much for saying this, Dr. Ayushi. Hard the new concept, plus I'm very happy Dr. Hediat say to hear this. If possible, okay, Dr. Arshino, to do another mock seems like. New concepts, okay. 70 questions. This is in alpha. This is, we have it already in alpha genius. If you can do a new one alpha genius, we can do this. We have lots of 70, we have lots of mocks of 70 questions as a complete paper. Better to fix our concepts before going to exam. I love Dr. Zara to hear this. Hard mock, okay, I will do hard mock. Yes? One more mock, no problem. Another ADC part 1 mock exam, new concepts. Okay, I will do for you, doctor. Thank you so much, Dr. B. Thanks, Dr. Shashan. Which one, doctor? Can please elaborate more about this, Dr. Hediat, for me? If you want to add more things, reduce things for me, please let me know. Dr. Bidu, please do that type of mock that is best for us, as you know what exam wants. Thank you, Dr. Raza, for your trust. I really appreciate this. Different mock with all types label included. This one, Dr. Shelba, was all types included, Dr. Shelba. Most of this stuff is from TG and Bidu bites and small things, most of it. Like the synco part, I would say the concept is general concept for general dentist, but you may need just to think a little bit more about, but I can make it more simple if you want. I can make it more simple than this. Like instead to put the concepts which is you need to, because sometimes you put more than one logic behind the question, not just only one thing. If you want to do this, I can do this as well. If this can make it better, I can do this next time. Yes, similar and new concepts, that's okay. You want a very difficult mock? No, that's it. Very difficult, too hard. No. I would say this level is okay. Or maybe even, I would say this level is good. Like if you ask my opinion, that level is good. Because guys, I want to make you strong. I told you this before. I want you, when you go to exam, you really be able to go through all this concept. Once you see something similar in exam, you'll be able to answer the right way. Same questions? Okay, same questions. You need very tricky mock? Okay. So important to understand the way we have to think questions. I love this, Dr. Luciano, Dr. Marwan, Dr. Luciano. I love this. That's totally true. Another mock, please. Soon, please. Okay. New mock, please. That's fine. Yes, new mock. Okay. Okay, guys. I believe we did for today for our chamber for part 1 for March. All the best to you. Sorry, for September. All the best to you for March. Guys, you enjoy right now what you do for March. Just only come to the session, as I will say. Just take the notes, write it down now. Because once you start to take the notes for March, people, will be exam easy if you start right now. Please, guys, don't make it late. Don't have late start for March. We have lots of things to cover these days. For September, all the effort for you right now. September, we have 3 weeks left about. We'll be great. We'll be doing great. Thank you very much, guys. I was very happy to have all of you today. And you stayed for more than 2 hours and a half. I really enjoyed all of you guys being here. Thanks very much. And then our session will be on Monday to discuss new questions with new concepts and new. That's private session, by the way. Thank you very much, you guys. Have a great night, every one of you. Thank you very much, you guys. Bye bye. Thank you. I forgot. I should put this pen back. Bye again, guys. Thank you. Bye bye.